This episode is brought to you by Yin Fang toothpaste. Yin Fang toothpaste is 4 ingredients: coconut oil, baking soda, cacao butter, and nano-hydroxyapatite. It's non-toxic, there's no preservatives, it has a low abrasivity which preserves your teeth, it's supportive of the oral and gut microbiome, and it's remineralizing. Stop.
Okay, we are back today. It's just Whit and I, Dr. Whit Pharr. We are going to talk all things dentistry, toothpaste, holistic health, oral microbiome. We're going to go all over the place and really dive in. This is something that we've been wanting to do for probably a year, and we just haven't scheduled it. It's harder to schedule when it's just you and I. But here we are. So, for those of you who are not familiar with us and with our credentials and who we are, most importantly, who you are, Whit is a board certified prosthodontist, and he is also a holistic dentist, a naturopath. I'll let you talk through those certifications, but basically, he's been to like a ridiculous amount of school, and also has a 25-year career in dentistry under his belt. So you want to explain
Yeah, definitely. Yeah,
who you
coming
are?
up on my 20-year anniversary, being out of dental school and working on patients, which is kind of surreal to say because there's a lot of mouths I've looked in and people I've
Yeah.
talked to. And yeah, that's something that you and I have in common, I think, is this passion for learning. You are probably someone that has taken, you've also been to law school and yoga teacher training, all these certifications, and you continue to push yourself. And I think we're very similar in that regard. Something we kind of connected on early on in our relationship is this like desire to keep learning, and it spills over into our everyday life. We're always talking about these things, and even on the drive over here to film this, we're basically like learning stuff as we want to talk about it more because we just have a natural intrigue to all these different conversations, especially focused around health.
Yeah.
And, dentistry is part of health.
Yeah.
And we say health starts in the mouth, but I'll backtrack a little bit because I have a lot of letters behind my name. It can be a little confusing. And I've even gotten to this point. It's almost a little bit of a sickness where you want to just keep getting credentials and all that stuff. You could be a forever student. However, I've stayed in the private practice world while I've accumulated all these credentials.
You've been working.
Yes, yeah,
You're
exactly.
not a forever student.
I'm not in the academic setting.
Right.
Like a lot of folks with all these letters will stay in a university setting. And however, I've chosen to be in private practice. I always wanted to have, be a business owner, flex that entrepreneurial muscle, live or die off my ability to run a good business and treat people well. But so for me personally, I started with my regular, the first letters are DMD. I went to dental school. I did 4 years of dental school in South Carolina, and it was a great experience, right? So, I did my regular dental training, got out for 4 years as a general dentist, went back and did a 3-year training in prosthodontics.
That's where we met.
Yep, there we go.
Fast
So
forward.
I don't work on prostates, it's prosthodontics, and that just means prosthetics. So anything replacing missing teeth, whether it's veneers, crowns, dental implants, dentures, I'm a technician really, but also a clinician. And then I also have, I picked up a certification in prosthodontics, and I'm board certified in that. I challenged the board, which is a serious process to get that credential. Out of all the trainings I've done, that is by far the most rigorous, was completing prosthodontics and then getting board certified. So it's a real differentiating credential. I also have a master's degree for ceramics research. So I was really fascinated by some of the problems I was having when I was a general dentist. There were certain ceramics I saw that were failing patients early, and I specifically wanted to look into that more while I was a resident. So I did a master's research on dental ceramics, specific types of ceramics. And so not only, learned about a little bit about ceramics and why things work and don't work, but I got to be a published author in a peer-reviewed journal when I was finishing that process. And that's an amazing thing for anyone that's ever actually been published in a peer-reviewed journal. It's not as easy as just like, I got an idea, I wrote a manuscript, they accepted it and published it. No, there's a lot of influential factors or people or organizations that want you to learn certain things and then describe them certain ways. And getting accepted into which journal, there's a lot of political forces behind how scientific research is published, distributed, and that was very eye-opening.
Yeah, and I think part of that too is learning how the research can be shown to be favorable or unfavorable to various things depending on kind of how you present it. I think that was like a really eye-opening process. Plus all the studies that when you're in prosthodontic residency, y'all were reviewing all these studies all the time. And that, fast forward to when we developed Yin Fang, has played a huge role in how we went through the R&D process, because you have like an understanding of how these studies are created and then presented, that I think a lot of people don't. If you haven't gone through that process, you don't really understand how it can be manipulated. So you read it in a different way, like maybe face value versus like reading between the lines. So anyways, that was like an interesting thing that has like come back around and influenced the development of a product, that we eventually got into ourselves. Okay, so fast forward, you have your board certification in prosthodontics, you have a master's, you also practice dentistry, and then you went back and got your...
Yeah, so I went back and did this curriculum called the ACIMD, and basically it's on integrative medicine and dental medicine, and you become a certified and technically a board certified naturopath. So very different than, all those years of dental training I had done, because we don't really look at like dental slides and dental techniques and the technical aspects of repairing someone's tooth or mouth. Is very holistic systemic health issues, with the foods you're eating, what you're the things you expose your body to, like how these things might impact your overall health. And so it's really not a dental credential, it's a holistic health credential. And we joke because it was a 1.5-year track, and go up to New Jersey frequently for these weekend classes. And after the first weekend, I remember calling you being like, well, we're just talking about all the stuff that you've been telling me ever since we met. All these things about, ways to improve your overall health and things you should be concerned about, how to modify these risk factors, all that stuff.
Yeah.
And it really cemented the idea about dental health, oral health. It is systemic health. We hear people say, we say a lot, your health starts in your mouth because that's the beginning of your digestive tract. 100% true. I mean, it's a foundational pillar to your health.
Yeah. So for the way that you did it, I think is interesting. I think it's becoming more common now, but it wasn't that you went straight into the holistic path. I think people are doing that now. There are more tracks in that direction. But you had actually practiced for 15 years at least, right? And so the lens through which you went through that certification process and studying all of that was very different. And I remember the conversations that we had. I think it was actually even more thorough, because it's kind of like when you work and study versus when you're just studying. A similar idea in like probably any field, but you were really critically thinking about the things that they were teaching, not just from a like truth perspective, but also like, okay, but is this even possible in a clinical setting in a dental office? As an example, and we'll get into this, but like everyone's like, no root canals. And like, yes, that makes sense. But then also, the conversation we had immediately was like, okay, but if you take a tooth out, then what do you do, right? It's not black and white. Like then you're talking about putting something prosthetic in that maybe your body doesn't deal with as well either, right? So it's not, anyway, so it was just a very interesting process. I think that's something important to note, that you've gone through all these certifications kind of in a different way. And so the way that you're viewing kind of systemic health and dentistry and just like longevity and that kind of stuff is different. It's a little bit more realistic.
Yeah.
Than I think maybe if you just go straight through school and think that everything is like kumbaya and holistic dentistry and you're going to be able to use all these biologically compatible things and it's just going to, work out perfectly every time. That's not really the case in real life and in a real clinical dental setting. So I think that's just important to like set the foundation as we talk about this, that your experience is you're drawing from both sides and also from both sides of the education paths and also from real experience treating really complicated dental patients. I think also for people that don't understand what a prosthodontist does, and specifically what you do, you've run a private practice. We had a private practice that was both prosthodontic focused, and we also saw a number of general dentistry patients just because people wanted to be
friends
at our
and family.
office, right?
Yeah, exactly.
So you kind of kept both of those skills going, and then simultaneously opened or started running a dental implant center, which is what you're doing primarily now. And that type of dentistry is, most of your teeth have to come out, pulled out, or they have already rotted out. So you think about the type of systemic health that someone has to have, barring something like an accident or like a drug problem, or cancer. Those types of things can happen as well. But in general, your systemic health has to be pretty poor to have your teeth kind of like essentially falling out of your head, right? So then once they come to you, you're talking about the replacement of those teeth, right? So you're talking about a full smile replacement, really. So it's a very different patient population. It's like really complicated surgeries. A lot of times you're dealing with a lot of systemic health issues, right? It's not just about the aesthetics. It's also about the bite function and all of that. So you've really seen kind of like the gamut of dentistry, and not many people do the type of complicated dentistry that you do. I would say very, very, very few.
Yeah, for
right.
Sure.
You've done over 4,000 like full arch, meaning like you take all the teeth out on the top, all the teeth out on the bottom, and put like whole sets of teeth in, right? So I know there's more formal language for that, but I'm just explaining what it is. So that is just to set the stage for the way we are going to talk about dentistry is through your lens, right?
Yeah.
And it's going to be different from someone that maybe has been doing holistic dentistry, quote unquote, from day one in a general practice, or maybe they only practice with kids or whatever, right? Like, because you've seen the beginning and the end of the spectrum, and everything in between, and the reality of what that is for the patient in real life.
Yeah. And I'm not going to pretend to know everything either.
Sure.
But I think I appreciate what you're saying there, because my practice history is very nuanced or complex. I've worked in 7 different offices over 20 years. And I've worked in a hospital setting for a couple of years. And I've also worked, trained in South Carolina, worked in Virginia, worked in Texas, trained in Texas. So actually, being familiar with different like regional approaches to how different problems are addressed really opens your eyes too. Because when I was in Virginia, everyone maybe did veneers a certain way, but then you move to Texas and it's done very different. And there's pros and cons to each approach. And that kind of nuanced approach, or maybe just understanding that things aren't so black and white. And I kind of going along with what you're saying here, there's a lot of dentists or health focused people like on social media that are like, it's always this. It's never this. They'll use the words always or never, like never a root canal. That
flag.
shows someone right there actually doesn't know what they're talking about.
Mm-hmm.
Not that they don't know what they're talking about. They lack some of the real world experience, because you can give that person a scenario that will make them pause in their answer.
Mm-hmm.
Okay, you're never going to do a root canal. Well, here's a scenario. Your 9-year-old kid knocks their tooth out at a baseball game. It falls out of their head. Someone puts it back in their head. Okay, that, a week later when everything settles down, if you want to keep that tooth in your kid's head, and maybe you're even going to do like some stem cell treatments or things like that to hopefully save the tooth and help it growing, well, there might be a root canal involved in that.
Mm-hmm.
Are you going to take your kid's front tooth out? You can't put an implant in when they're 9 years old. Just going down an example of like using the words always and never is just not a good tactic.
Yeah.
And there's certainly valid points on all sides of every argument. And when you're the patient and you're in the chair or your kid's in the chair, the best thing you can do is don't rush, gather data, gather information, make an informed decision.
Yeah. Okay, so from that perspective, how would you explain what holistic dentistry is?
So I would focus in on the simple answer to that is it's looking for root cause and looking at the whole body versus traditional, carpentry type dentistry is you got a cavity, you got a hole in your tooth, and I'm going to grind this hole bigger, get all the nasty stuff out, and I'm going to fill it with some material, and I'm going to polish it down and shape it so it's functional. So it's, it's like, it's literally very technical work, similar to like, when I work on car mechanics and carpenters or people that are just technically oriented, they're always fascinated with my tools, because I tell patients all the time, 50% of what I'm doing here is like carpentry. It's mechanical. But the other 50% in my mind is biological and this holistic. And so where that gets into is like, okay, what's the root cause? Like, I feel like that's probably the simple answer. Holistic dentistry is going further to understand what's the root cause, and and asking next level questions to why, being curious. Why is this happen? Why did this happen? Why is this happening? What are some of the factors that might be causing that, and what's contributing to those factors, and can we address those? How can we address those? What other providers are needed to help this person or patient address the root cause? Because if you don't address the root cause, well, they're back, the system continues to degrade. And that's where people get frustrated with dentistry. Patients get frustrated with dentists is they feel like they're on a merry-go-round, a never-ending saga of, I got to go back and see that hygienist, and then the dentist comes in and they tell me I got more cavities or my gum disease isn't fixed and I got to have more surgical cleanings or whatever it might be. But so yeah, that's how I look at holistic dentistry is we're not throwing out the repair work or technical work that still needs to be done, but let's have a further conversation on what is the root cause? What are some of the ways that we could help try to make those root cause challenges go away?
Yeah. And a big part of that is seeing the body as one connected thing rather than one connected system rather than only looking in the mouth, right? So I think this goes back to originally, or not originally, but at some point, dentistry got separated from medicine. When medical schools were created, dentistry was not included. And just even the way that that sets you up to kind of feel like the mouth is not part of the rest of the body that you are trying to heal. If you're talking about medicine, which is really interesting because obviously, I mean, the mouth is something that interfaces with your environment all day long. I mean, the most really. I mean, your skin certainly, but your everything that you put in your mouth becomes part of you, right? Like that's your nutrients are the building blocks for everything in your body. So, yeah. So when I think of holistic dentistry, I also think of it is root cause, but it's like the way you get to the root cause is by thinking of the body as one whole system, which seems obvious, but most medical providers do not think that way. And it's changing, I think, but a lot of medical providers don't think that way. They're not taught that way. They're taught, like specific body sections, essentially.
Yeah.
And dentistry is like an entire field just dedicated to the mouth, maybe the throat and the sinuses a little bit. But like, yeah, so that's it's a different way of looking at the whole system.
Yeah, without a doubt. I mean, the kind of divergence of dental medicine and, systemic medicine from dentists being very technical type people long, century plus time ago. I wasn't alive then,
You
but
were not there.
My fellow dental predecessors were cutting hair and extracting teeth and making dentures. They were doing, so like hairdressers and dentists have a lot in common. I think the way that we interact with people, we talk with them while we're working on them. They're awake.
Yeah.
And also the paying customer pays at the end of it versus like now we have to go through some crazy convoluted insurance mediated payment system that makes sense to no one and medical health care.
Mm-hmm.
Yeah, but it's too bad. My feeling on this just changes. I don't think I have like this. Part of me wants to be like, it's too bad that dental medicine and let's call it like, traditional medicine diverged a long time ago because the patients, they don't get the ability for the dentist to work with like, an ENT works on the ear, nose, and throat. And the dentist works on the mouth.
Right.
I mean, where's the borderline there?
Yeah.
Right. I mean, I'll never forget when I went to a hospital, I worked in the hospital and talking to like a ENT surgeon. He's like, thank God you're here. I have to cut out someone's jaw tomorrow. And I wasn't going to have any teeth for them.
Yeah.
I mean, can you imagine? And this is like,
rampant.
I mean, so that stuff is actually still happening, is that you have people having surgery by let's call it medical doctor, and they're going to cut out dental structures. But because of the way our payment and insurance and just even the way hospital administrators look at it, like there's the poor patient is like missing a huge part of their care team.
Yeah.
And
yeah, like not even in the building oftentimes.
Yeah. And, and I personally, like I was coming out of high school, I was super into dental because dentists didn't work on Fridays. And I was like, that looks cool.
It's easy to trust what we've always been told, but sometimes you find a better way. Yin Fang is unlike anything else, a toothpaste free of harsh chemicals, designed to care for you and your family with holistic, safe, and effective ingredients that benefit your microbiome. Created by a naturopath dentist and health coach, it's thoughtful oral care that fits your values, all while because small changes make a big difference. Yin Fang, redefining oral health.
I like science. I like math. I like working with my hands. I like talking to people.
They tricked you.
Yeah. I mean, so I thought that was appealing. But then I went to college and I made good enough. I was making great grades. And I was like, oh, I can go to medical school. Like, didn't really study in high school, but I went to college, studied really hard, and had very good grades. And I was like, I could do anything I want. I got all these options. And medicine seemed very prestigious. And so I started working in the hospital on Fridays, volunteering. And I really... what was super helpful, anyone that's like maybe thinking about dentistry versus medicine, this helped me a ton. I got to know medical students and dental students personally, like hung out on the weekends with them. I lived in this big complex where my college town was, same town as a medical school and dental school. And so we were partying on the weekend, socializing on the weekends.
Mm-hmm.
And so I got to ask them, like, what do you like about this? What don't you like about this? And I also did that when I volunteered in dental practices and medical practices. How do you like your work life? How do you, what do you like about it? What you don't like about it? And I found a lot more dissatisfaction and things that didn't appeal to me on the medical side of it. So it really pushed me back towards dentistry. And I also like to understand. I want things to make sense to me. And the way money is funneled through, let's call it traditional healthcare, like medical care, it makes no sense to me. Like, I don't get it. And I worked in a hospital. I don't get it. Who are these people paying? Who's paying? Like, everything's converted into these other units that's not even dollars. Like, that doesn't make sense to me. So, whereas in dentistry, it's still like you meet a paying customer, you talk about, this is our things we're going to try to fix and solve, and here's your cost, and we agree to it, and we do it. Very black and white. So
yeah, or more black and white, sure. Okay, so I want to talk about the oral microbiome because I feel like it's having a moment, or we're going to make it have a moment.
Yeah.
I think it's having a moment. I think a lot of, especially in the functional world, the oral microbiome is coming up a lot right now. And it's just this whole thing where people are, again, recognizing that it is a huge part of the system. It's an integral part. It's the beginning of the digestive tract, right? And the more we understand about the microbiome, the gut microbiome, the more I think the research is coming around on the oral microbiome, and we're seeing how we've kind of gotten a lot of things wrong in the past, not understanding how it's set up. So can you, for people who don't understand what this is or haven't heard about it, can you explain like what the oral microbiome is and why it's so important and why we're like really focused on it right now?
Yeah, I feel like simply stating that we have a ton of bacteria in us. Like, we're mainly bacteria.
Yeah.
Okay. And we'll say the gut microbiome, like our whole immune system, the way, are we depressed? How do we feel? You talk about gut instinct. I mean, like, this is related to this, and like your whole overall health is related to the bacterial combinations that we have in our body. It impacts everything. And the oral microbiome is the gut microbiome. Just like we were saying, like, where do you differentiate between what an ENT is doing and a dentist is doing? You don't. They cross over. They're the same. They're all connected. And the oral microbiome is part of the gut microbiome, which we are learning impacts all of our systems, the way the whole body system, we're talking about holistic health, everything is impacted by how this community of bacteria are interacting with each other. And traditionally, what's changing right now is traditionally it's like, well, we've identified these certain bacteria are very common in these certain conditions. Like, so simple and like strep mutans is high in people with cavities. So we're going to like focus on treatments that kill strep mutans. Like let's obliterate, just literally obliterate the environment, start fresh, like clean slate, scorched earth to the bacteria and start over.
Like antibiotic style.
Sure. Like specifically antibiotics or antibiotic type treatments. Yes.
Yeah.
And yeah, we're seeing that doesn't work. It doesn't work. What you can do is like preferentially select for even worse bacteria to be bred to take over, right? Or you kill all the bacteria and the fungus takes over. And you talk to like people that work in hospitals, infectious disease people, they get super nervous when all the bacteria are dead and the fungus take over the party. Like I remember the guy
really hard to treat.
The main like fungal like treatment guy when I was in residency, he came and did a lecture for us, and he's like, "I'm the fun guy that talks about fungi," and I'll never forget him. But he's like, seriously, like they don't want to page me, because if like the fungus takes over, like we're in trouble.
Yeah.
And the bacteria keep the fungus in check. They all keep each other in check.
Mm-hmm.
So it's the big change is about support and not death and destruction.
Yeah.
That's kind of how I like to say it. It's like, how do we support the environment you don't have to kill everything off. You don't have to kill anything off.
Mm-hmm.
You want to make this environment where everything's, it's like communism of the body or something. Yeah. I don't know
Socialism.
if that works or not, but.
Yeah, well, because like even like strep is a good example because everyone has strep.
Yeah.
In their body. It's when the balance is off and the strep is overtaking that you have issues, right? You have infection and or like low-lying infection. Sometimes it's not like strep throat maybe, but you can even have it in your gut where it's like creating an imbalance and causing, systemic issues just because that bacteria is thriving where it shouldn't be, right? It should be at a lower level. So, I think the oral microbiome is definitely, it's hugely important. Like you said, it is, I think a lot of people have heard about the gut microbiome and like gut health, and that has had its time. That's been going for a number of years now. So I think most people have heard about that. And the truth is that it's inextricably connected. It's just your microbiome, right? And the difference between the gut and the oral microbiome is that you have physical access to your oral microbiome. So you can really make an immediate impact on a daily basis. So, and thinking about that, let's talk about mouthwash because this is something that I think most people still use. It is like they have, I think people have just been probably using it their whole life. Their parents use mouthwash. It's like they want to have like minty, fresh breath, and it's just a habit, And I don't think that it's really gotten out. And I know this because even in the gyms still, like, which I feel like are pretty holistic places, it's like mouthwash next to the sink everywhere.
Yeah.
And they're primarily alcohol-based mouthwashes, although some of them have tried to shift a little bit away from that. But can you talk about what mouthwash does to the oral microbiome and why it's so bad for you?
100%. So, yeah, this is certainly not understood in the population of patients I'm talking with all the time. Is you alluded to it earlier, my typical patient is 65 to 70 years old. They're on 7 or more medications. So they're dealing with chronic health issues. Their teeth have fallen out of their head. So we talk about health a lot. And they're usually looking for tips, from me and my team of like, what should I be doing? And, blood pressure is like one of the more common topics we talk about, or we see on their, they're taking medications to help treat the symptom of high blood pressure. And yeah, so essentially, it's going to be mouthwash kills certain types of bacteria that live on the back of your tongue that are involved in nitric oxide production and regulation in your body, which is a key component to the blood pressure regulation in your body. So if you're killing off these bacteria that are involved in this process of regulating blood pressure, you're kind of like handicapping your own body at being able to control it. They're not able to process certain nitrates as you eat them. If you're eating a good diet, the way a good whole food diet works is you hear people like heal themselves with food, right? You eat certain foods could actually help with your blood pressure. But if you're swishing mouthwash multiple times a day, well, you're not getting the benefits from that healthy diet because you don't have the bacteria, the beneficial bacteria, to help in that process. And my personal journey with mouthwash, I started to literally hate mouthwash about 6 years ago. Had nothing to do with blood pressure and holistic health. I'm running a surgical practice where we're doing major oral surgery every day. And I do not like complications because it's a major surgery and major complications are major problems.
Yeah.
And So we found that some of our challenges immediately following surgery were related to the rinses we were giving patients. Okay. So first off, we'd be like, do not use Listerine or Scope or any of these alcohol rinses. They're going to just destroy your fragile gum tissues that we've just like sutured back together. It's going to open up wounds. So like for that reason, don't use those. And then there's a real classic chlorhexidine. It's a classic mouth rinse given by dentists. It's, antibacterial, right? It sticks to the gum tissues. And then some research started coming out that mouth rinse was impacting the way the bone cells are healing after major oral surgery like mine.
Mm-hmm.
And that's a big problem. I need the bone to heal after we drill screws into it. Like, we're doing orthopedic surgery in the mouth. We're putting dental implants in on all of our patients. I need the bone to heal normally. I cannot be giving a mouth rinse that's interfering with this. So I basically just said, we're going to saline because that's what some of the good research coming out was like, just use salt water, use saline. And I can't even tell you, it was immediate. And when something works is when the dental assisting team or the hygienist start coming up to the doctor and going, man, this looks so much better than how it used to look. Their mouths they're healing faster. Like the reports these patients are giving to us. So, that was my first like step into hating mouth rinse.
Yeah.
And not using it myself. I was like, okay, this stuff is not good. Like, and then I started learning about the blood pressure stuff. And it really just cemented that reality so if I'm ever going to rinse my mouth, which I do occasionally, like if I ever get a scratchy throat or I feel like my mouth's off, salt water, teaspoon of salt, warm water, just what your grandparents probably told you to do. But it works. It helps balance the pH. And again, it's not going to like out and out kill off everything. But so if you are somebody that is noticing your blood pressure is going up and you're using mouth rinse, you should stop.
Yeah, and it's been shown that just stopping mouthwash will make a difference,
Yes.
Which is crazy. That's something that's like the perfect example of something that you're doing every day that you think is benign has a dramatic impact on your health, and that's, again, it's the oral microbiome. It has such a connection to systemic health. Like those things matter. The things that you do every day matter, right? Like, I think especially in the holistic world, right? It's kind of overwhelming to think of all the things, all the toxins that you're trying to avoid all the time. And I hope people hear in this from us, right? That it really is about balance. Like, it's not about being afraid of everything, but there are simple things like switching, like just stopping mouthwash and switching to salt water, which is free. Basically, salt
super
obviously
cost
you
effective.
pay for, but it's fractions of a penny. It's more cost effective and it's better for you, and it's something that people that are doing mouthwash, they're doing it at least once a day.
Yeah, and there's something that needs to change in our society and in the world. We've all been conditioned that having minty breath equals oral health. False. Whoever came up with this, it was a nice run. But that game is over. Okay? Yeah. Minty breath. We'll start with the mouthwash. Think about, okay, you swish with this, and now if you go breathe on someone right afterward, they're going to be like, ooh, minty breath. Great. Awesome. Well, how does your mouth feel another 15 minutes from now? It's dried out.
Yeah.
Right? Ask any, would you ever use an alcohol-based face wash now, like that we all used in the 90s?
No, I use oil on my face.
There you go. And this is where I think a lot of products are going, is like organic
moisture
oils,
is
right?
better.
Yeah. So this whole thing about mint equals health, false. Like it's done. Like I personally avoid mint, and we came across that realization when we developed the toothpaste.
Yeah, but it's not a mint leaf. Mint
Right.
leaf is
Sure.
fine. If you want to
Yeah.
cook with mint or put a mint sprig in your drink, that's not what we're talking about.
No, we're talking about these synthetic mint flavorings that are combined with sweeteners, sugar alcohols, whatever you typically like sugar alcohols and synthetic flavorings. You get these flavors from a place called a flavor house, right? They're literally like chemical factories that are going to devise something that's going to make your brain feel like, oh, that feels fresh, right? But it's harmful. Like it's harmful, and it needs to stop. Like having a clean mouth comes from maintaining good saliva, hydration, saliva, like oils in your products.
Yeah.
Those are going to be better.
It's like perfume. It's like you end up chasing the next mouth rinse or brushing, or because you're constantly needing, or you chew gum all the time. I feel like there's so many people, especially since developing Yin and Fang, like that they're like, oh, but can you do a gum? And the reason that people are so addicted to that is because they think that is helping their breath. And really, it's like it's hiding something in the moment and making it worse over time.
Yeah. Yeah. And like we were saying, the oral microbiome's having a moment. Another huge moment that's happening is the realization that these personal care products, deodorants, perfume, shampoos, these things are with phthalates and parabens, sunscreens, whatever. Like, they're not good for us. They're really bad for us. I mean, we as an American population, we're consuming so many of these products and we're super sick. Cancer's everywhere. I mean, I think that so many people are having this realization that like these things are bad and we're looking for products that we can understand the ingredients in them. We know where they're sourced from. We understand what they are. They're not synthetic and chemically derived. And because I don't want to, I don't want to develop some health issue. And if my daily products are contributing to my risk factors for that, like getting cancer or anything like that, I'm trying to lower that. I'm trying to like stack the deck in my favor of not getting these health problems. And your personal care products have a big role in this.
Yeah.
Yeah.
And the good news is that there's so many companies doing it right now. Like, so for pretty much all of this stuff, not everything, I think there is still an issue of like, trying something holistic or, like more natural, and it just doesn't work as well. And so then people won't switch. Right. But definitely in, a lot of the categories, people are definitely moving in the right direction. And I think there are some really effective products, so certainly in like cleaning categories, and probably, if you want some kind of deodorant, I'm not a big deodorant fan, but I think there are much better things that do work, so, and that's like one of the things when we developed Yin and Fang is like, I was very focused on non-toxic, right? I was ingredient focused and you were focused on efficacy.
Yeah.
And the reality is like, you weren't going to let us start brushing our teeth with something that didn't work, So that was a big, I don't know, not fight, but like it was, you just weren't going to sign off and allow the family and our children to switch to, not that you were going to be able to control what I did, but certainly not switch our kids.
Part of the conversation is like, well, let's not throw away, like, do we need a remineralizing component? Should that be, what's our risk factor? And,
Yeah. I mean, it needed to clean and remineralize, and, whereas like, I think in a lot of categories, not just toothpaste, but it's like you can have the non-toxic version, but maybe it's not doing the thing that the toxic version actually would do that you liked, So,
I want to say like that the best healthcare provider you're ever going to have is yourself. Like when you have health coaching clients, and some of the best providers I've ever observed treating patients, they allow the patient or the person to really express and discover the root cause challenges themselves, right? Because a lot of times it's things they can control. And where I'm getting at with this is, for example, deodorant. Like you and I both stopped wearing deodorant.
Mhm.
And when what that's opened my eyes to is if I eat like shit for a while,
Yeah.
I smell different.
Yeah.
If I feel like I'm starting to get sick, I smell different. If I'm coming off a cold, I smell different. That's your body like signaling to you. And it's the same in your mouth. You know, my mouth's drier than normal or like feels off. Like, okay, think about like, but if you're just masking
Right.
your body's feedback loop, you're not really like in touch with your body. And, you know, and that's important to be in touch with your body and the signals your body gives you because, you know, it's not beneficial to like, you're not going to call your doctor every week for like, I think this is happening or that's happening. And, you know, it's really best to hone into your own body systems and adjust accordingly from there.
Mm-hmm. Yeah. Okay. So let's talk about also, we kind of touched on it before, but root canals. We briefly went through this, but it is I think lots of people saw the documentary a number of years ago that then got pulled. And just since then, there's so much information that has come out about the dangers, the real, very real dangers of root canals. We have very good friends that are endodontists. Like endodontists are wonderful.
That's a
And
root canal doctor too.
That's a root canal doctor.
Specialist.
A specialist. Certainly go to a specialist. It's a very specific technical procedure. But let's talk about why this is not actually like an always or never situation and what the real dangers are and the kind of the risk benefit that you have to weigh if this is a decision you have to make.
Yeah. And every person's different and every person's preference might vary somewhat, right? So I think that from being a dentist on my side of it, you know, I just like to always make sure I'm informing patients of everything I know and we have a thorough enough conversation to where there's no regrets about a treatment decision that was ever made. And because opinions change over time and, you know, we will always want to do if you're the patient, you want to do what's in your best interest, right? And so there's a lot of scary shit out there on root canals. I mean, I posted a video the other week that was like a little
scaring people.
Yeah. Oh my God. So it was like,
I know what you're talking about. It was gross.
It was like an animated, It was one of those, like, I'm sure it was like, I reposted it. I'm sure like, you know, AI generated a
what it looks like.
Drilling into a tooth, scooping out the cavity.
Yeah, it was gross.
Cleaning the inside of the tooth. Right. Yeah. Filling it. And I even had a root canal doctor message me and be like, man, that's pretty gnarly when you see it like that. And because, you know, it's like also, it's like, oh, I got my knee replaced. Do you want to know how they replaced that knee with the saws and all that stuff? I mean, it's
crazy.
So, but root canal specifically, it's a tough one because there's so much scary shit out there on the internet. And it's such a complicated topic. And I feel like it's complicated because I don't think anyone's necessarily lying. I think they're just not being thorough. Like, so people that say like, oh my gosh, like the real fear is this, like root canal, you're cleaning out oftentimes like dead or dying stuff inside the tooth, the nerve, blood, lymph, all the cells that live inside encased in the tooth. You got to clean all that out. And we typically fill it. Usually it's filled with a rubber material, right? And so, right, the concern is that you're leaving something dead in the tooth. Okay. So that's the concern. Number one, like statement, like nowhere else in medicine do they leave something dead in the body. All right. We'll work through that. Okay. And then the other thing is like, the reality is like dentists we physically clean out the inside of that tooth. It looks like a little pipe cleaner, little rotary pipe cleaner. That's what we do. We go in there and we strip all that all the dead stuff out of there, rinse it with bleach, and we put that little pipe cleaner like down a little tube. But there's this huge network of tiny little tubes that we can't actually mechanically clean. So we rely on bleach or bleach-like treatments to get in those little, nooks and crannies.
Yeah.
Okay. And that is what's happening, right? And yes, do even the best specialists in the world remove every bit of bacteria out of that tooth? No. Okay. So that's where like the kind of, I would say, fear-based conversation has its foundation. Well, you weren't able to clean it all out, so you left some dead stuff in there. Okay. What is that dead stuff? It's bacteria. What's the microbiome? It's bacteria. What's a bad microbiome? When certain bacteria get too out of control. Okay, well, so is that little bit of remaining bacteria impacting the microbiome? That's the question. Because in some cases, it's not, right? So well done. I mean, I told you my population is an elderly population, and I've met a whole bunch of people late in their 90s with root canal treated teeth. Okay, so it wasn't killing them. But so as you can tell, I'm not going to come out and like condemn root canals. I think it's the proper treatment in certain situations. And the tooth, that's left behind. I mean, you're leaving behind the tooth that was always there, right? And there's so many good studies that show a well done root canal, the body accepts it. It regrows the like attachment from the gums to the tooth to the bone is perfectly strong. Okay, so it can be done correctly and it can last for many years. And I don't think it's a health concern when done correctly, and it heals. Now, there are some negatives to root canals for sure. There's no perfect option in all these scenarios. The negative is, hey, the teeth are brittle. You just like drilled out all the insides of it. They crack. They become the source of chronic inflammation when they crack. Maybe the doctor doesn't clean out enough of the infection. And so now you could develop a chronic infection around a tooth because the root canal wasn't successful. That's a big problem. So like a unsuccessful root canal treatment is a major health concern. So, and the tooth should be taken out. Like that should be aggressively like diagnosed, treated, like get the tooth out of there. So what you'll find is like basically you'll find people saying, well, we've looked at all these people with like cardiovascular disease and we've backtracked and we've said how many of those people had root canals. So there's like correlation based studies and like it's a pretty high percent. And so the root canal must be contributing. Now, those same people don't want to talk about the studies that they did where cardiovascular disease problem, and they looked at how many of these people needed a root canal. Oh, that's actually maybe the same or higher. So it's like, you condemn the root canal and but you don't understand. It's like the holistic health picture.
Yeah, it's like,
the problem.
Was it the microbiome issue to begin with that caused the root canal that you still haven't addressed? Is it like really just the root canal, or is that it's also probably having trouble because the microbiome is also suffering or struggling?
It's really the root cause conversation, not like let's destroy root canals as the big problem. It's really like what's the root cause? Why do they need the root canal? And so if you're like a patient and you got a root canal, this is what happens. Like you see a documentary and you're like, crap, I got 3 root canals. Like, do I need to go get these taken out? And there are a lot of doctors that will just take them out, put an implant. I am an implant doctor. I love placing implants. It's what pays our mortgage, right? And if I see a failed root canal, I'm going to tell them, I think you should just take it out. You could try to maybe redo it again, but like if it didn't work the first time, like maybe just take that out and put an implant in. And when we take out those teeth, it looks nasty a lot of times too. You know, it's like infected, like pus and gross tissue up there. That is not good for your health. Okay, so like I also am a very passionate person about do not leave an infected root canal in your head. And if you're a patient, the best way to currently know about this is you're going to get like a CT scan of your mouth, cone beam CT. Many dental offices have that now, and you can even have like a oral radiologist look at your cone beam. You want to really, really know, my root canal, like if somebody calls me, we're in Texas, we're in Austin, somebody calls me from Virginia and says, oh yeah, I just saw this documentary that just came out. I'm super freaked about my root canals. I don't know what I should do. I'm going to say, go get a cone beam CT, have it interpreted by a oral radiologist because they are going to dissect that thing, I mean, to the micron. And they're going to tell you, they're going to say if they see any areas on that x-ray that looks like the body's reacting to it. Okay. And that's probably the best piece of advice for someone to understand, like, should they go get this tooth taken out? Because, all right, scenario is all nuanced, right? Okay, we're going to take out the root canals. What are we going to put in its place?
Yeah, this is where it's not, I think you have to think through the entire scenario, right? Like, there's nothing better than your original tooth, you know? Well, now the tooth is compromised if it has a root canal, but still, it's still in your mouth, you know?
Yeah.
Because the other option is some sort of either an implant, which is metal.
Or ceramic. Yep.
Or some sort of bridge situation.
Yeah, meaning you grind down the adjacent teeth to look like little nubs and you glue fake teeth on top of it that have like a bridging fake tooth.
Yeah. Yeah. So yeah, and once you, as you have taught me, it's like once you start messing with your teeth, like if you're grinding down adjacent teeth, right, you're making those teeth weaker. Now you have issues on those teeth that you didn't have before, right? So it's not like I mean, you can just take the tooth out and leave it, right? But then now your bite's going to be messed
bone loss and bite shifting and you know, it's like a pier and beam house, right? You know, you're going to start taking out a tooth here, take it off a tooth here, take out a tooth here. Now all of a sudden your foundation's collapsed.
Right.
And now you got big issues.
Yeah.
Yeah. So I think that fundamental to the root canal question also is if you need a root canal, usually you've destroyed the tooth. You know, it's not like, you know, unless it was like trauma, you had something like get punched in the tooth and the tooth is all still intact, but it was like the trauma caused the tooth to die. That's a separate scenario. Usually you've had a giant cavity, like a big old massive cavity that went all the way through your tooth down to the nerve. So like one of the other questions that's fundamental to this conversation is like, okay, is that tooth, whatever, after we do the root canal, how are we fixing the tooth? And how long is that going to last? And how likely is that not to leak into the mouth and become like a uncleansable area that will breed bad bacterial combinations? And so that's a big part of it, right? You know, sometimes it's not like, should I get a root canal? Because, you know, that is part of the conversation. Should I get a root canal? Am I going to harm my health by getting a root canal? But it's like, well, how predictable is this even going to last? And that's also where as someone that does implants, I hear a lot of frustration from patients. They're like, yeah, I spent $4,000 getting a root canal and a crown on this tooth. You know, 3 years later, like, thing broke. I got to get an implant now. I should have just done the implant. Valid conversation.
Yeah.
Like, for sure.
Well, and also on the other end, like there's people who get an implant and their body rejects the implant.
Yep.
So.
Happens.
Yeah.
Yeah. And I would say that it's always going to be a nuanced scenario. And implants require more interventions from unexpected, call them complication. May not mean that your implant's going to fail or anything like that, but they require significantly more interventions than root canal treated teeth. And if you look at, like, let's say you look at studies 10 years out, the survival of a root canal treated tooth and an implant, it's about the same. They're right around 90%. Okay. So like, and survival is an interesting word that we use because that just means it's still in your head. Doesn't mean there hasn't been a problem. There hadn't been any inflammation or infection. It's still physically in your body, hadn't fallen out, either one. So that's, I think that one of the sayings I particularly like is, it doesn't have to be this or that. It can be like first this one, then that one. But it's always like you want to understand all these little things.
Yeah.
In making that decision. So, if you have a root canal and you haven't had a cone beam CT to evaluate if it's healthy or not, you should do that.
Yeah.
You should do that, because things that are lingering chronically in your body, I do think those could cause major health issues.
Yeah.
So I certainly, and if it's a bad root canal treated tooth, get it out, get an implant. And that's my first. I believe in that. I see it all the time, do it all the time. Yeah.
What's a cavitation?
Oh, okay. That's an interesting topic. So, and when I did my integrative course, we had an oral surgeon come in and talk for the weekend about and one of the topics was cavitations. And I found that to be really interesting because he taught about it, but he said he didn't really do that much of it in his practice. So, all right, a cavitation for the context of this, what you're asking me, like a cavity in a tooth is like a hole in the tooth, right? A cavity. But cavitation is what you're going to hear when a tooth is extracted. You take a tooth, pull it out of the jaw, there's a hole there. Okay. Ideally, the body regrows that hole with bone. There's little cells that are left behind in the ligament that was holding the tooth to the bone, and those cells signal your body, grow bone, fill the hole. Like whether we put bone grafts in there or not, that's what your body's supposed to do. And in some circumstances, you could have like gum tissue, let's call it gum tissue fills the hole. But if it's like an inflammatory, like scar tissue, it might have bacteria in it, that's not good. And so the hole might, in your mouth, the gums will grow over it, but you could have like this nidus or like a little ball of infected gum tissue down in that old hole. So that's essentially what a cavitation is. And I think that there's a lot of BS out there on this, a lot. And I think people need to be very careful. Okay. So it should be obvious on the x-ray before you go get a cavitation surgery. Someone should be able to show you on a CT scan. You should be able to look at that and go, oh yeah, see all this solid bone everywhere. It's underneath all your teeth. It's all solid bone. Where you had this one tooth, black area on the x-ray. Well, it doesn't look right. I mean, you honestly don't have to be a dentist. You should be able to like have someone show you your x-ray and scan through it and be like, that's normal, that's normal, that's normal. Like, what is that? Why does it look weird there? Okay, if you just have that scenario, okay, you should have this cleaned out, maybe because you don't want it to turn into something, become problematic. And the challenge with that is, this is where, I'm going to give you my opinion. I just feel like what I see frequently is people being told they have cavitations where their wisdom teeth were. It's a whole separate conversation. We should talk about wisdom teeth later. Okay, but this is the deal. Most of these wisdom teeth, because of our society, we've said, let's just take out wisdom teeth. A lot of them are like healthy teeth. Like mine, I took mine out. They weren't even erupted into my head. They just barely started poking through the gums. Like there's not gonna be a cavitation. I mean, an infection there. The tooth was basically sterile, right? And so you got people get chronic health issues and they start searching for answers. And my concern is they might seek out someone that does cavitation surgery and they're like, well, let's try it. Maybe you have cavitations. And I just haven't I've taken a class on it from an oral surgeon that teaches about cavitations. I wanted to try to learn about it before I made a strong opinion about it. So, because if you ask anyone in any academic setting, they're going to be like, that's bullshit. Okay. But let's not, I get out of the academic setting because they don't know everything. They live in an isolated bubble oftentimes. And a lot of times they don't know a lot. So, I wanted to go talk to my peers and learn from people that were doing it and learning it. I feel like it's oversold, and I feel like if you have it, it's pretty rare. But like if you have it, you should be treated by it because.
Have you ever seen one?
Yes, not in a wisdom tooth site. I've seen infected extraction sockets that grew in, like call it scar tissue with inflamed. It looks inflamed. And what's the trigeminal neuralgia? I learned from one of the most smartest old school dentists, practiced a long time ago. Trigeminal neuralgia is like this severe nerve pain that some people get. This guy, he didn't call it cavitation, but he was tracing a lot of these cavitations from like previously failed root canal treated teeth, extract it, like say a canine or something in this region. This infected tissue was left behind, and it caused like
trigeminal neuralgia.
Yeah, it caused like a inflammatory process, and it got the nervous system involved, and the nerve right there. And this guy that taught me this was the furthest thing from like a holistic dentist. He was a carpenter mechanic to the very best. He was known for like bite schemes and reconstructing things, but he had a personal experience with a patient, and he became very passionate about
connected the dots.
Yeah, this guy's name is Bill McCorris. So anyone that knows dentistry and bites knows what I'm talking about. He's not a holistic health nut. He's past, but he's a super smart guy, and he couldn't unsee this. So yes, cavitations exist, and what he called it was like this necrotizing, insidious. I forgot he had a NICO was his acronym, but basically it's dead tissue from an infected tooth. Okay, so the tip for the if you're a patient getting a tooth extracted, I would encourage you to talk to the dentist. Say, make sure you use the tools to scoop out all that bad tissue, because as a dentist, you can take a tooth out, boom, done, next patient. That's what happens in a lot of places.
If they're getting a tooth extracted,
just,
to make sure.
Yeah, pull that tooth out, next patient, done. It'll clot, the blood will clot, body will take care of it. And it might. But the real proper technique is you take certain instruments and you like scrape down to the bone.
Gross.
Scrape, get the nasty stuff out. Because it's like you got to clean it, or else you might leave some infection behind.
Okay.
So
basically, it is a real thing. It just possibly might be something that
it's been hijacked and used as a fear-mongering technique. Bottom line, you know. So be careful, because it's a real thing if you have it, but don't get tricked into an exploratory surgery.
Yeah.
Because what if they nick your nerve, and now what if you have a complication? And I know in my town of Austin, I know people have lost their license for doing cavitation surgeries that weren't indicated, and they had complications. Okay. So this stuff happens.
Okay, next hot controversial topic, although I think there's no controversy.
Dentistry's
it's really
controversial.
Really clear. Let's discuss your take on fluoride.
Okay. Fluoride, it does remineralize teeth. I don't want it. I don't need it. I don't want it. I don't put it. I don't recommend it for you. I don't recommend it for our kids. The only people I'm probably recommending it for is in the form of a tray of someone that's got, they had cancer and they had their salivary glands blasted from radiation, and like they're not good candidates for surgery anymore. And if these teeth fall out, it's going to be the end of their life. Okay. And even at that, I might look at a different remineralizing paste than fluoride. Fluoride can remineralize teeth. That's out there. That's there. It's true. But it appears to be a neurotoxin, and it appears to be an endocrine disruptor. Okay, big red flags. So the question is, are there other things I can do to remineralize my teeth? Yes. Okay. And foundational to that is having good saliva. Right? Eating a whole food diet, getting exercise, listening to your body, having good systemic health. Okay. But if you need a remineralizing agent, nano-hydroxyapatite is currently what I think is a better alternative. Right? I think that's the best alternative right now. It doesn't I haven't seen any research that makes me be scared of it. And I've been investigating it myself for a while. I have emails where there's a specific company out of Portugal that put all their products through the European Safety Council on product testing, and they've submitted their own products for testing and resubmitted, and it's been a multi-year saga. And I started emailing them probably 5 or 6 years ago because I wanted to learn about the ingredient. Like, hey, send me, I want to see, like, do you have any trace metals in here? I want to see, like, what's in exactly in your formulation. Send me all your, the data on, like, what's in it, your MSDS or whatever. Send it to me so I can look at it. And so I wasn't like a quick one to jump on it, but over time, it's proven as a much better alternative, in my opinion. And you can look at, like, research that's come out of the journal in Nature, very peer-reviewed, respected journal, showing that oftentimes fluoride at the levels that's in the municipal drinking water can be impacting your thyroid hormone. Like, it's pretty clear evidence, in my opinion, as I read that paper. So, like, that's small amounts. So getting mega doses in your toothpaste, you swallow some toothpaste and you absorb it in your glands. Like, I'm just not on board with that. Your hormones are super important, and I don't want to be taking daily, products that are messing with my hormones. Yeah, I don't think you should either.
Okay.
Yeah.
Okay.
Well, I'm curious, what do you think about fluoride?
I don't like fluoride.
Okay. And why don't you like fluoride?
I think that's actually, it is important to say too that like this is not who you always were. Like,
oh yeah.
Your opinion on this and your stance on it has changed after a lot of research and understanding, like, systemic health in a different way. Correct me if I'm wrong, but and it used to just be, I mean, you were handing out Crest and fluoride topical at all the appointments, so
yeah.
It's not that you have always seen it this way, right? I think, like, the way that you work is you have to have, like, an overwhelming amount of evidence in order for you, especially because you were trained in a totally different way, right? I think it's very, however you get trained in whatever area or field or you tend to be brainwashed in that direction,
Yeah.
Right? Because that's what you learned. And until you learn something else, right? That's just your go-to way of viewing the world. And so I think for you and for a lot of dentists that are coming around to the research behind the toxicity of fluoride, dentists and medical providers and general population, like, there's just so much research. They're trying to hide it, like, as best they can, but there's an entire, like, website, like the Fluoride Action Network has an insane amount of research showing, just the problems with it. And truthfully, like, the original studies where it's like you take a tooth and you soak it in a cup of fluoride for like 24 hours or something. Like, yes, does that remineralize? Sure. But, like, no one's soaking their mouth in fluoride for 24 hours.
Right.
I hope not. And definitely don't do that. Like, so, I think it's just what you said. To me, it's like, is there something that is better? Can I get this in a healthier way? Like, and it makes you think about what is the actual goal. Your teeth, you're trying to get minerals into your teeth, so I first think about food, diet, electrolytes, like, is there enough, am I remineralizing through those pathways first? And then is there something that can be effective in just kind of like an extra assist?
Yeah.
And is that thing causing other problems? And fluoride to me is just, when you know the history of it too, I mean, you can dive down that rabbit hole if you want, but like it was a manufacturing byproduct that they needed to put somewhere, so they put in the water system. That's not, that's different than in your toothpaste, right? Or your like a fluoride varnish or whatever. But especially in water, I mean, that's a whole separate topic, I guess. But in the water system, I mean, I don't drink tap water either, because once you understand, like, even just how they clean it and the cleaning byproducts that are left in the water, no thanks. Like, that's a lot of really heavy toxic chemicals. So I try to avoid that stuff if I can. It's impossible to avoid all of it, but if there's a better alternative, which there is, nano-hydroxyapatite, and we've seen in our own use of it too. Like, there's tons of studies, of course, but we've seen it be really effective in our own mouths, in our own family. Like, not just me, not just you, our kids. So it's kind of like a no-brainer.
Yeah, it's interesting. Like this, like talking about all this, because the evolution of like my perspective. If someone would say like, I'm struggling from cavities, and you talked to me 15 years ago, I would have thought about the classic, Featherstone Curtis article, this article about cavities management by risk control. Boom, here's the different fluoride, here's the protocols we're going to use. Mm-hmm. That's how I would have approached, if you said you're getting cavities, that's how I would have approached you 15 years ago. Mm-hmm. Now, if you approach me and you're like, I'm getting cavities, I'm like thinking, are you taking, D3K2, things that like specific supplements that help you absorb and deposit minerals back into your hard tissues? So I'm
Are
certainly,
you mouth breathing?
Yes.
What's your diet like? I mean, I think that's the other piece of it, is that I have a very healthy mouth, and I haven't had cavities in years. I got a couple in law school. Because why? I was like not sleeping and eating garbage and super stressed out, right? My entire system was redlining,
Mm-hmm.
But I just don't think about it like that. Like, I'm not trying to heal cavities personally. I think about it more like, what is supportive of my entire mouth, right? Is my saliva feeling healthy? Like, is my mouth not dry?
Mm-hmm.
Is my breath good? Are my gums bleeding? And is my enamel healthy, right?
Mm-hmm.
Is it wearing away? So the idea that you would have cavities and then be told to just like soak your mouth in fluoride, like it doesn't even make sense, even if you agree with fluoride. Like, that's not the problem. It's not ever the problem. A lack of fluoride is not the problem. If it were the problem, then
we'd be fixed.
Because it's in our water. You bathe in it. You're brushing your teeth with it. The dentist is putting it on. Like, that's not the problem, obviously, right? It's not that simple.
Yeah.
It's a much more complicated system. So, I'm a definite no.
Clearly. I think that was obvious by the answer.
Water filters and spring water, and haven't used fluoride. I mean, I secretly switched to non-fluoride toothpaste in our house years ago, without you even realizing it, because you told me not to do that.
Okay, so that was clearly a hard no on the fluoride from your side. So.
Hard no, yeah.
But I appreciate your answer, because it's so good to hear. Like, I love that about our conversations, is like, I can't undo the classical dental training, and you can't undo your holistic approach. And I like that, the fact that we tackle these conversations and combine things. And I feel like I just like that approach.
Yeah. Okay, let's talk about some trends in toothpaste, like holistic trends, things that are maybe have been fads, or kind of like trending ingredients like charcoal and bentonite clay and other things that kind of have marked the alternative toothpaste space, even baking soda. Like, so what is wrong with conventional toothpaste and what is wrong with some of these more holistic toothpastes that we saw as we like.
Yeah, I think that generally speaking, the concern was like you're taking out bad and putting in a different bad. Like you got like just garbage.
Greenwashing.
Yeah. And like, so to answer your question, like traditional toothpaste has fillers, stabilizers, detergents, scent and flavoring things that have they don't have any therapeutic benefit. They're not helping your mouth. They're there just for conditioning, like psychological conditioning to make you think that this product is working.
Yeah, like the sudsing as an example.
Yeah. Yet that sudsing compound is the culprit for the number one pathology found in people's mouths, right? So,
which is?
So like they call it aphthous ulcers. We see it all the time, and as dentists and patients will report this all the time, and frequently like that can be solved by just changing the toothpaste and getting this garbage out of and that really shows that like these things that we do every day, like twice a day, they impact your health. Like your body is sending you a signal like, I don't like this.
Yeah.
It's ulcerating your gums. And you'll see it also like people get this like dermatitis around their mouth.
Perioral dermatitis.
Right. So I mean, it's like you're putting something in your mouth and your body is like trying to send you the signals like, please don't do that. But we're so conditioned to think that like, well, this is what's cleaning my mouth.
Yeah, I think people, I mean, I think it's obvious to us, but I think it's like, who would suspect their toothpaste?
Right.
Like, unless it's like brought to your attention, or if it's like you switch and all of a sudden something happens, but, and maybe you make the connection. But yeah, I think most people don't look at the ingredients in their toothpaste. You're a perfect example. I mean, you went until not that long ago before I was like, have you ever looked at the ingredients in the toothpaste? They're disgusting,
Yeah.
When our kids were little, and I was like, this is gross. They're not going to use this. And you were like, what's in it? So I was like, yeah. And I think there's such a trust with patients and their dental providers. If the dentist hands you something, you're just like, this must be it. This is fine to use,
Starts when you're 6 months old or 2 years old, whenever you first start getting dental care. And it's like, and then you're given these products and then it's paired with TV commercials your whole life.
Sure.
Showing you like,
white sparkly teeth with this shine on it.
And the challenge is basically, I think that's really all it is like the greenwashing term is like, it's got different stuff in it, but if it's got a long list of chemistry experiment sounding compounds, it's probably not good. Yeah. It's probably not good for you. And so there's like a toxic component, I would say, which is what I'm referring to with that first part of the answer. But then the abrasive side of it is something, toothpaste abuse is the term we use, right? That people can harm their teeth, and they frequently do. They brush their teeth with like a side to side sawing action, and their toothpaste is very abrasive. So we get these little notches in your teeth, and then now you need dentistry. Now you need like a filling material put on there, or you have like exposed tooth root surface, and it's sensitive teeth now. And so, after the toxic part of it, there's this abrasive part of it. And so you really, like, if you think about it, like, okay, toothpaste is so good for you. Why they're like, only use a tiny amount and only brush twice a day. It's like, well, that kind of sounds like advice you'd give to something that's harmful. Only use a little and use it sparingly.
And call poison control if you swallow it.
Right. Certainly sounds like a concerning product.
Yeah.
So, it's so obvious, it must have been hard to see. I don't know how else to say it, but like, that's what happened. And so we started, personally, we started trying all kinds of brands, and it was like, what are they putting in this stuff? It's so abrasive. I could literally watch it abrade my enamel like sandpaper.
Yeah.
Like that's not going to be
talk
good.
about what are some of the, because I think that was like the eye-opening thing for me, certainly, where because I immediately went to the more holistic and alternative brands, and it was like clays and I honestly can't even remember.
Yeah, and the clays were, I think, not the
charcoal.
worst out of all of them. Actually, some of the clays like can make a case for they're good for you if they don't if they test for metals and stuff like heavy metals, and that's not in there. Like there's some therapeutic aspects of some of those clays, but yeah, like the charcoal. Be careful brushing your teeth with that. It's very abrasive, and you can like literally Google search these things, or even on Wikipedia, and look at like hardness values. But some of these silicas they put in there, and they like even add like there's toothpaste that add metal shavings to it. I mean, that's a real thing. I literally met a patient who carved the biggest notches in his teeth of all time. And I'm like, what's your toothpaste? And he showed me the toothpaste, and it's like the very most abrasive one on the chart. And there is a toothpaste abrasivity chart that anyone can Google. And you'll basically see it's like a 0 to 200 scale, somewhere around there. 0 is just brushing with water. Like baking soda is a 7. And, you know, most toothpastes are going to fall between 100 to 200 range. Like too abrasive for me. I'm not using that in my mouth. And I know where that leads because I'm a dentist. It leads to enamel loss.
Yeah.
So, but like some of the silicas, and some of the hydroxyapatite's a nuanced ingredient because you could have micro or nano or just listed as hydroxyapatite. So,
which is hydroxyapatite is a mineral. It's what makes up the majority of your enamel.
Right. And so if it's just the micro or hydroxy, it's probably just crushed bone.
Which will scrape your teeth off.
And that, like, if you want to take that, like, maybe there's some, like, taking it as a supplement, but, like, brushing your teeth with it makes no sense to me. You're just going to harm the teeth.
Yeah, that's what we switched to also, like, we switched to something with regular hydroxyapatite, the crushed bone version, and that was something that you noticed within a couple of weeks and made us throw it away.
Yeah, I don't even know if it made it a couple of weeks. I think I immediately was like, this is not good. Yeah. I'm always like polishing things. I feel like I'm hyper aware of abrasivity. Something I'm like interested in my line of work. And I was like, you could put the paste in your hand and be like, what in the hell? Like I could feel the bone.
So the nano version it's the same mineral. It's just nanoparticles.
It's just non-abrasive.
So it gets into those little missing spaces and remineralizes. That's why your teeth look whiter and your enamel's stronger.
Yeah.
It's much more effective.
Yeah, and combining, so, you know, like we currently use Yin Fang, and that's 4 ingredients, and combining like the oils with baking soda and nano-hydroxyapatite, I feel like it's like the least amount of ingredients that get you what you want. You know, there's nothing in there for like sudsing and all that stuff, but have the remineralizing component plus the cleansing ability and pH neutralizing of the baking soda.
Wait, so is charcoal used? Do people use that for whitening?
Yeah, it's in whitening toothpaste for sure, and people will also use it as a whitening. But
so it's like the way it whitens is it like theoretically is it supposed to like rub off debris?
Yeah,
but it rubs off so much that then your teeth look yellow actually over time.
Yeah, find me a dentist or dental hygienist that uses whitening toothpaste. They're not out there.
Yeah.
So that's kind of crazy.
This is actually an interesting, I want to talk about this for a minute because I love natural things. I always am looking for like the, as you know, I want to do things as like supportive to the body as possible. And, you know, people are very concerned with whitening their teeth. That's like, I feel like for a long time, that was like the number one question people would ask, like, well, does the toothpaste whiten? And yes, the answer is yes, the Yin Fang does. But the way it does that is it remineralizes and the baking soda like effectively cleans without damaging your enamel. Coconut oil also has some like whitening properties. But anyways, I think that it's interesting for you and I to talk about how we would whiten our teeth if we wanted to whiten our teeth further than the daily whitening that's happening because our toothpaste is actually like helping to remineralize. So I already see a whitening effect from our toothpaste. A lot of customers, that's like the first thing they notice actually, which has been really interesting. But even though I am, or not even though, like because I am always wanting to do the more supportive thing, if I'm going to try to whiten my teeth, I will just use a tray of bleach and bleach my teeth once a year. Because personally, I think it is, again, it's like the things that you're doing all the time, like every day, are going to be contribute much more to your toxic burden than something that's like a one-off. So I trust my body to be able to deal with bleaching my teeth for 30 minutes or 45 minutes, like 1 to 3 days once a year, and just, make sure that the bleach is just on my tooth and not like smeared all over my mouth, right? But like to do that and not swallow it and all of that stuff, and then deal with just detoxifying whatever from the bleach.
Yeah.
Versus like using something like charcoal and rubbing the enamel off my teeth every day, or some of these other bleaching agents that are either toxic, or like, I mean, some of the whitening toothpaste have like peroxide or bleach or whatever it is, and I'm not really even sure. But you're doing that every single day. That is, it just seems, that to me is more problematic. And I think that is something that's good for people to hear, because I do tend to the more holistic side and the more natural side, but I think that is a healthier way to have kind of the vanity of it, the aesthetics piece, if you want something a little bit more over the top, like a more obvious bleaching situation. What are your thoughts?
Yeah, no, I actually very much in line with your approach. I mean, and I think that a couple key things you said was you had like a professionally made tray. So you're really able to hold the bleach just on the tooth. So you're not like absorbing it through your gum tissue, and like everything in moderation, right? It applies to so many things in life. I met someone a week or two ago who literally said she was obsessed with bleaching her teeth. And then all of a sudden she started like, the teeth became very fragile and frail, started chipping away, started having tooth loss. And she's basically like going to lose all of her teeth. And she traces it back to this like bleaching obsession. So everything in moderation, right? Be careful. I'm like you, like once or twice a year, professionally made tray, 3 to 4 days, a couple hours a day for 3 to 4 days. That's my personal opinion. And there's fads that are going to keep coming in and out. Last year, this time, there was some trend of like putting purple paint on your teeth, essentially. Because it would, the way color science would work, it would actually immediately make your teeth look really white. Like that product.
It's like purple shampoo.
Yeah. And that product is like gone. I don't know. I mean, like, there's probably concerning reasons why that's not being advertised so heavily anymore. Because I'm sure a lot of people bought it and tried it.
Yeah.
But like, it was pretty fascinating because the color science is real.
Yeah.
Like there's actual like legit dental studies that back up the color science part of it.
Sure.
But like, I'm sure it was like just the most gnarly
toxic
ingredient list.
Yeah.
That was, people were like, who knows?
Yeah.
Anyway, but I don't know, maybe it'll come back in a different form someday that actually, because there's actually some science behind it, but it just was like, maybe too good to be true.
Yeah. Yeah. So getting back to toothpaste, I took us on a bleaching trail, but I think that's important to talk about. I think that's something that people ask about all the time. And, I think there's, the way I think about it is just always trying to do the thing that is going to be least burdensome on the body, right? And like, it's not, again, because you can't avoid everything, right? And it's paralyzing to even think about trying to do that. So, okay, so we talked through conventional toothpaste. I think like there's lots of it has two problems, right? The toxins and the abrasivity, and that's like something we found along this journey ourselves.
One other huge thing I want to make sure we bring up is like ditching Teflon floss. Like that's been, I don't know when that first took over, when probably about the time that Teflon got into everything else in the world.
Yeah.
But your typical Teflon floss,
which is all of your floss, if you're curious.
Most flosses, right? That's like putting forever chemicals straight into your bloodstream.
But it's also so crazy. The boys had a cleaning recently, and they got the little bag with the little mini floss and a toothbrush, and I pulled the floss out, and I haven't seen, because we use our own floss, our bamboo floss, which is so much better. But it's the same thing. Like, I haven't used other toothpaste in a really long time, and I forget. I pulled this floss out, and it was like, I was like, this is like nothing. It was so thin.
Yeah.
And like, I put it between my teeth. I was like, how in the world? I can't even believe that. I mean, I rarely floss my teeth before Yin Fang floss anyways, but honestly, it doesn't do anything.
Well,
it's so slippery.
Thing. Yeah.
It's so slippery, and it's like so thin. I was shocked.
Yeah, so that's like, in addition to putting forever chemicals straight in your bloodstream with Teflon floss, like, do not do that. The other part is it's not as effective as it should be.
Yeah.
Old school hygienists used to tell me this years ago. They're like, once we switched to Teflon floss, it never cleaned as well. So, we have a bamboo floss that I would recommend, whether it's ours or somebody else.
Yeah.
Something textured, non-Teflon. It's going to remove that little plaque biofilm so much better. And that's a huge part of like having a good oral microbiome is maintaining that biofilm. And so a textured, bamboo floss is what we currently use and recommend.
Yeah. Okay. What would you say that like bleeding gums are a really common symptom that I mean, obviously there's like real periodontal disease that is much gnarlier than just bleeding gums, but bleeding gums just in general are a sign that something deeper is going on. Can you explain
For sure.
why?
Yeah, my perspective shifted as I've like thought about holistic health, without a doubt. So there's different like categories and that you can fall into. So like there's not a one line answer that applies to everyone. So some people, it's hygiene. They need to do a better job getting the plaque and food debris, or like they have been so long since they've been cleaning, they got like tartar, like mineral buildup all over their teeth. There's a kind of like you need a cleaning, like physically clean your teeth better. And so the hygienist or a surgical cleaning, like stuff might need to happen. But then there's also the conversation of like, why do some of these people have gum disease with moderate to minimal amounts of like buildup on their teeth? They have like bone loss and bleeding gums and all that stuff. And like, it's, as the dentist, we maybe still typically like, well, let's get in there and surgically scrape and clean and all that stuff. And okay, that's part of it. But the real root cause is probably like metabolic dysfunction. They have metabolic disease, or their like immune system's gone haywire, something like that, right? So, that's where my mind has shifted when I see people with this bone loss. Like they come to me and they're like, I'm afraid I'm gonna have to lose my teeth, or I've lost a lot of my teeth. Instead of like, you should have cleaned better, it's kind of like, it's that metabolic dysfunction. It's you're metabolically unwell, and that's got your body immune system. It's haywire. It's gone crazy.
Yeah. Our conversations have like changed so much over the years, because like it used to be you would come home and, tell me about some, crazy case or a specific person, like this person had something going on. And I would be like, as an example, I'd be like, well, are they mouth breathing? And you would be like, what does that matter? It was like, I would be like, yeah, but you would, I guess a better way to describe it is you would tell me what their diagnosis was, like what their textbook diagnosis was. And I would be like, yeah, but that's not actually what's going on. Like there's probably a gut issue there. There's I would like, and you at first, prior to all of this, like, this journey that you've been on, you would be like, no, this is just what you see. You see this, and then you treat this way.
You do it this way. You get this.
Right. You clean the mouth or you do the surgery. And I was like, okay, but you're missing like the, not like it's just a different way to think about it, I think. And that has like evolved. Our conversations have evolved. And now, the way that you present the story about the patient to me is like more like, I think this is going on, and it just has changed so much.
Yeah, my hairdresser the other week was like, man, I think I'm going to get diagnosed with like rheumatoid arthritis. And I'm going to, probably get prescribed like Enbrel or something similar, right?
Mm-hmm.
And like, I'm like, oh man, back in the day, I was like, that sucks. But now I'm like, hey, have you ever looked into like how these fragrance compounds can really maybe impact your immune system and maybe trigger an autoimmune event? And like, or maybe it may not like solve you all the way, but like, you kind of live in like this like super fragrance.
Yes.
Like you can't walk in there with like, oh, I smell the conditioner and shampoo and scents. And like, I've just changed. I looked at things differently now.
Yeah. Mm. Yeah. Interesting. Okay. We're going to have to wrap up here really quick.
I feel like there's a couple big topics we should talk about.
Okay.
One is expanders and expansion on kids.
Okay.
So I think that as it relates to oral health, microbiome, all that stuff, like the way our diets are, the way we're challenged with all these like environmental challenges has led to, let's say, constricted or smaller jaws. Okay. And this also leads to more mouth breathing, inflamed tonsils. Like one of the most amazing things I've learned in the last 5 years was that if you expanded a kid's upper jaw with an expander, they're less likely to need their tonsils removed. And there's certain groups, I think is in Stanford is one of them, they've said this is first line treatment, is go get the expander before we take this kid's tonsils out. And that hits home because we had a kid who also had huge tonsils, wasn't getting strep throat, but like the surgeon was like not eager to get him out, although some of the other doctors were.
Yeah, they were like medium large.
Yeah,
but
like in managing that through like getting the jaws expanded. So I think that's a huge thing for parents to know. Like, do it early. You can even use. We started treating our third kid when he was 4 with the myofunctional appliance, Healthy Start, to try to get him to put his tongue in the roof of his mouth the right way to naturally expand things. I mean, and he's got all the spaces in between his teeth. I mean, that stuff works. You don't have to wait. Start early.
Yeah, I think that's the thing to talk about because I think what happens, obviously, is if your kid isn't sleeping or they're sick all the time and they're having some sort of breathing issue or behavior problems at 4 or 5, you don't want to just do nothing, right? And if the only option given to you is take the tonsils out and the orthodontist is saying, well, we're not expanding till they're 9, who wants to wait 5 years while your child suffers,
right. Yeah.
So I think the point to be made is you can do early intervention. You can start at 3, as early as 3. And there are appliances. We haven't used Tooth Pillow, but that's like one that I hear about a lot. Healthy Start we've used. Different providers are kind of aligned with different early ortho interventions, but
and it works. We've got this documented in our own child. He had a we call open bite, like his front teeth weren't coming together because he was thrusting his tongue right there. We did this appliance, Healthy Start, and within 2 months, his bite corrected itself, and his jaws have developed ideally.
Yeah, and this is another point that you were not sold on. This was something that in dental school and all through like residency, everyone was like, "This stuff is garbage." You're not, or there's just like a stigma around it that like things don't work, maybe because it's removable. So
it was really just like, well, no. It wasn't talked about. It was like, this is the way you do it. You wait till they're 6. This is how you do it,
Yeah.
And it was like this, there was no like recognition that these other approaches that start earlier might actually have validity to them.
Yeah.
And so that's,
Yeah.
And
go ahead.
I was saying, I would like to, while we still have a couple minutes, we kind of started with adult topics and we worked our way towards kids. And then I think we should go to the actual like newborn baby.
Oh, yeah,
where it all starts.
Yeah.
One of the best public health initiatives that could ever be done for oral health in this country is to stop the overuse of C-section birth. because when kids are born via C-section, they don't get the benefit of traveling through the vaginal canal and getting this like imprinting of specific types of bacteria that are going to help kind of take root and help grow in the most ideal combination of bacteria for the best start possible. And that's a real sensitive topic for sure. And it's something we've talked about a lot, is we've experienced every type of birth. I feel like with the 3 kids, we went, and I see it in our own kid. And I read this in research. The kids that are born via C-section, their first exposure is like sterile surgical gloves, not immediately put on the mom. And I think that, and I know because we interacted with the OBGYN, that after our first one said, you got to have a C-section again. You're always going to have a C-section for all your babies. And that was total bullshit.
Yeah.
And he was proven wrong twice.
Yeah.
Because we had 2 more babies delivered naturally. And I'm a dentist. I can physically see the difference in the microbiomes of the kids born naturally. Yeah.
Yeah. Yeah. So I did have a C-section. The other thing that I think actually happens is, there's fascia that's affected that I think affects the way your jaws develop, like your airway develops too. And I think that's something that, just like being pushed through the birth canal, that there's just a lot. There's a lot that happens. And obviously some people, it's like, if you have a C-section, you have a C-section.
Yeah.
I ended up with a C-section. And what I wish I had done, which I think there's more information about this now, but you can have someone, maybe your husband, I don't know who does it actually, but you can swab the vaginal canal and rub it on the baby, and that will transfer some of the vaginal bacteria and help them populate. So there are ways to, like, if you are in that situation, I think what we're talking about is like just scheduling C-sections willy-nilly without any true medical reason for it. Like,
yeah,
it does have, you could do it, but it has like a lasting impact on your child. So
yeah, and I don't mean to say that I didn't mean to imply that every C-section was done, in bad faith or anything. Like, there's tons of reasons that it needs to be done.
Yeah, but it's overdone.
It's certain, but like that's my point, is like we experienced the stigma of like it's overdone, it's overused, it's overprescribed. Like, we saw it firsthand.
Yeah.
Like, and you hear from lots of other parents that experience that. And I think that would be one of the most profoundly impactful things in public health, for talking about oral health, is to not do it so electively.
Yeah. Okay. I think we're out of time.
Man, okay. Episode 2 incoming at a later date. And there's so much more we could talk about.
Yeah, definitely. This one was really good. So we'll be back. If anyone has like questions, send them in, because we'll schedule this again and do a even more thorough review of dentistry and whatever your like burning questions about this topic are, toothpaste or microbiome or otherwise.
Yeah, airway, so much stuff we could continue talking about.
Yeah, cool. Okay, until next time.